Hi, my name's Walter Montero. I'm a real estate and mortgage agent here in Cambridge, Ontario, and I've had the privilege of serving our community since 1987. Over the years, I've met some great people here in our community in many different businesses and walks of life. Some, of course, are well known, and others are some of the best kept secrets in town. So the purpose of this podcast is to share and introduce them to you. Welcome to the I Love Cambridge podcast. Okay, very good. We'll just ask you a couple questions. Michelle Ford, and you're the owner of Grandview Massage and Osteopathy, right?
That's right.
All right, perfect. So tell us a little bit about yourself and your services and where you're located and all that kind of stuff.
Well, when I saw your podcast, I Love Cambridge, I thought it would be perfect for that because I love Cambridge. I've lived here most of my life. My first job when I was 12 was for the Cambridge Reporter. And then when I was 14, I went to work at DiPietro. I was there for a year, and then I went to work at Dixon Bowl, and I worked there for 5 years. And then I left Dixon Bowl when I was 19, and I went to Branson's Restaurant, and that's where I met you, of course, Walter.
Yep.
And I worked there for 7 years, and then that's when Branson's closed 20 years ago, and that's when I went back to school for massage therapy. And then from there, I started working in the Grandview Medical Center, and that's where I've been ever since. So I've been working in very busy spots, popular spots in Cambridge my whole life.
Yep, so you know the whole town.
I know the whole town. I cannot go anywhere without bumping into people I know, so I have to be careful that I'm behaving all the time.
Is that why you opened up a location in Paris?
Yeah, yeah, right, because nobody knows me there. Well, I lived in Cambridge most of my life. The last 10 years I'm here in Glen Morris, but Glen Morris is just down the road from Cambridge, just on the outskirts. So we opened a second location in Paris, so I go back and forth between the two, and I live in between.
Okay, good. And you've got quite a few RMTs working with you, don't you? Like how many people do you have working with you between the two?
Yeah, like we were up to 17 at one point in time. I think we're down to 12 right now. I've got a couple on maternity leaves.
Okay.
I had one that chose not to come back after COVID. The career has become a little bit more challenging, but we can get into that later. But we have 12 therapists right now.
Okay, good. So tell us, give me a little bit of a rundown on massage. Who benefits from massage therapy, and then you can touch on osteopathy as well.
Yeah, for sure. I would say the number one person that walks through our door is somebody with repetitive strain injury. That person used to be a factory worker. That person is now someone who sits at a desk. I would say that's what we see the most of. If you're sitting at a desk for 8 hours, you are killing yourself and you need some manual therapy. So I would say that's number one. People that suffer from tension headaches, pregnancy, that's like a time in your life where we can make you feel better. So repetitive strain, headaches, pregnancy, motor vehicle accidents, twisted ankle, really just about anything.
Plantar fasciitis, I would imagine.
Oh, for sure. Plantar fasciitis. And that's something I treat more of now as an osteopath. So massage therapy is really great for muscle tension. But plantar fasciitis is a different thing. That really has a lot to do with posture and the way you're standing on the feet. So people are unsuccessful, for example, in treating plantar fasciitis because they're treating the symptom, not the cause. So you can put a frozen water bottle on your foot and you can stretch it out and you can do all kinds of stuff with it. But unless you change the way you're standing on that foot, it will never go away. So that's something that I would treat with osteopathy, and massage can help it as well. Okay.
So now let me ask you, with regards to massage, a lot of the issues that you've been talking about, they run sort of parallel with people with issues that people would take to a chiropractor. So
yes, yeah.
Where do you guys fit in? Should somebody go to a chiropractor first, massage first? Should they go to both? How would you address that?
Usually the patient decides where they're going to go first, because when you get a note from your doctor or you've hurt yourself, the first thing you do is you start asking your family members or your neighbor or your friends, where did you go? So it kind of depends, what the people around you are doing. At Grandview, I work with 16 physicians, so we're getting a lot of people sent down by doctor. So a lot of those patients are getting massage therapy. But if you go to your friend, they might have a great chiropractor, and that's fine too. Oftentimes, we treat people with massage or osteopathy. If I've hit a plateau and that person isn't getting better, I refer out. And that's part of our success at Grandview. I've always referred out. If somebody's not getting better, I don't keep taking their money. I send them to a good physiotherapist. I send them to a good chiropractor. And as a matter of fact, the more we all work together, the better the patient is going to be. And that's something I advocate for. I consider these other people in town peers. I never call them competition. And quite often I will call up a chiropractor or a physio and I'll say, do you want to work with me with this person? Because let's face it, the more eyes you have looking at you, the more hands you have, the more brains we have together, the better off you're going to be.
Sure. Okay.
So
now,
I think sorry, was your original question, did I answer your question, or was your question
I think so. I think yeah. So it's not so much of an either or. You're almost talking like in a collaborative type of sense in terms of at the end of the day, getting the patient the result that they're looking for.
Yeah, and that's absolutely what I'm about, working together. And osteopathy and chiropractic are very similar, but we also work well together.
Okay, so you've talked about osteopathy a bit. I'm a little bit familiar with it, but it's funny. It's a word that not too many people are. So tell us a little bit about that.
Yeah, we like to say we treat problems you didn't know you had in ways you can't understand.
Oh, perfect. Okay. Excellent.
Yes. So similar to chiropractic, we look at the body like it's a machine, and machines have to be symmetrical and they have to be balanced. So massage therapy kind of stops at muscle tension. If your problem goes beyond muscle tension, if it goes deeper, it's gotten to the joints, the ligaments, the tendons, and the body, the frame, the chassis needs to be realigned and straightened out. That's where we come in. So I look at the body and I look for the asymmetries, and then we try to line it all back up. It's sometimes difficult to explain the technique. You almost have to feel it instead of hear it. But basically, we put you on the table. You're in my room for about a half an hour. I try to line things back up. I use techniques that feel similar to massage therapy, but the clothes are still on. So okay. like a chiropractor, I'm looking for asymmetry, but a chiropractor usually uses a high velocity thrust. We don't do that. Our techniques are slow, soft tissue, softer, feels a bit like stretching. So it's almost like a myofascial stretching technique that realigns the body.
Okay, perfect. Now, when somebody is dealing with either massage or osteopathy, obviously people do go there for, come to you for different issues that they're dealing with. Do you have patients that just come on a regular basis just for regular therapy every so often? And if so, is that more common in massage or osteopathy or both?
That's definitely more common in massage therapy. And osteopathy, we're similar to a physio in that we try to come up with a course of treatment. We try to fix the problem and then discharge. And then I don't see you again until you're feeling unwell again. Massage therapy, because it deals with muscle tension just keeps coming back. It comes back. So massage therapists tend to see people more on a regular basis. But again, at Grandview, we try really hard to treat people only when they need to be treated, and we don't advise they come back unless they need to.
Okay, got it. All right. Now, you touched earlier on COVID. How are you guys dealing with COVID?
Yeah, it's been interesting. So we took 3 months off, and that was really tough on everybody because imagine 3 months with $0 in pay. Yeah. But we survived, and we came back, and it's very different, but we're completely used to it now. So lots of PPE, a fresh mask with every patient, lots of hand sanitizer, lots of hand washing. There's no cloth anymore in my office. I had to remove all furniture that had cloth on it, and so now everything is wood or plastic or vinyl. Everything is wiped down. There's nothing to touch in the waiting room. So you come in, you go to your room, you have your appointment, you leave. So very little contact. Lots of like even the solvent we use on our table, like Lysol isn't strong enough. You know, we have government approved solvents that we're using. So it's cost us a little bit more money. It's a little bit inconvenient, but it's, at least we're just happy to be back to work.
Sure.
We've put a 15-minute buffer between all the patients. So we have 15 minutes for the room to settle down and be sanitary.
Perfect. Yeah. I've noticed that one thing that I've noticed about coming into your, I go to the Paris clinic, is I don't really run into anybody in the waiting room. Like before you would, I mean, you had multiple RMTs there, but now it almost seems by chance, maybe at the door you pass each other, but certainly.
Right.
Yeah. Interesting.
Yeah, and there's a couple of reasons for that. One, we've done that strategically. We're seeing less people in a day because now we do have the 15-minute gap between people. And we've told people to kind of stay in your car closer to your appointment time. Don't come in a half hour early and read a magazine like you used to.
Yeah.
So, and part of it is just like, as a society, we've kind of gotten used to it. Don't go places you don't need to go ahead of time. You know, people, it's kind of common sense. The clients have picked up on that. They're coming in, they're having their treatment, and they're leaving. So there's no time in the waiting room.
Okay, perfect. Now I want to ask you about how your services are covered. Are any part of your services covered by OHIP at all?
No, massage therapy, osteopathy, chiropractic are no longer covered by OHIP in Ontario.
Okay.
Even physiotherapy is not really covered by OHIP in Ontario. I believe that you can have 6 physiotherapy treatments a year if you are under 18 or over 65, but basically OHIP doesn't really cover manual therapy.
Okay. But I would imagine there's like benefits that people have at work that massage therapy and osteopathy cover, correct?
Mm-hmm. Most people that are working have benefits.
Okay.
You know, there's always people that have part-time jobs and they either don't have benefits or they don't have great, but most working people have benefits for
Okay.
massage therapy and osteopathy, and we do acupuncture as well.
Good. So it's recognized by the insurance companies as something that they would cover.
Yeah, for sure. And even osteopathy, if you have massage therapy, you probably have osteopathy. And again, you've just never heard the word, so you didn't know you had it.
Yes. Yeah. Yeah. Perfect. Now acupuncture, you brought that up. Tell us a little bit about that. Who would benefit from that? Is that good for specific issues or ongoing maintenance? That kind of thing.
Yeah, acupuncture is wonderful. And it's another one of those things people know very little about. I've been practicing acupuncture since 2004, so I know quite a bit about it. When I learned it from a Chinese medicine philosophy. They have regulated acupuncture since then. So I'm grandfathered in. I'm still allowed to do my old-fashioned Chinese acupuncture.
Mm-hmm.
However, people that have learned, manual therapists, chiros, physios, massage therapists who have learned acupuncture in the last decade can't bill for acupuncture. They have to go through we're allowed to perform acupuncture. So I do acupuncture, but it has to be under the scope of massage therapy. The receipt would say massage therapy.
I see.
So if a person wants to use their acupuncture benefits, you must go to either a Chinese medicine doctor or somebody who has like a diploma, I guess. I would have a certificate. So like a 5-year diploma in acupuncture.
I see. Okay. And what are the most common issues that people are dealing with regards to using acupuncture as a remedy?
Yeah. So in our office, again, it would be mostly musculoskeletal pain, but I would say headaches, especially, not even tension headaches, but migraines and things of a vascular nature.
Mm-hmm.
Acupuncture is really great for that.
Mm-hmm. Now, a few years ago, I remember there would be guys that are different acupuncture doctors or whatever however you would address them, that would say they have a remedy for quitting smoking or something like that. Is that anything that you've heard of or that you've treated or?
Yeah, again, when I started out, those were all things I was taught to do. I know how to do that, but I'm not supposed to do that anymore. Since acupuncture got regulated, that's something that should be done by a Chinese medicine doctor. And I stick to musculoskeletal, something that a massage therapist would treat. That's what I would stick to.
Okay, perfect. All right, great. And in terms of somebody coming to see you, you've got I love your booking process. Tell us a little bit about your online booking process there.
Yeah, it's called the Jane app. It's a software that's been around for a few years. It's out of Vancouver, so that's wonderful because it's Canadian designed by a massage therapist, and it really is state-of-the-art booking software. It's pretty easy. All you need is an email address and a password, and away you go. It shows you what's available, which is great because when you call into the office, you kind of go back and forth with the receptionist. And by the way, that's fine too. I have a receptionist at the office from 8 in the morning till 8 at night. So those people that like to phone in and talk to a human being, we absolutely have that all the time. But those that like to book online, we have a very easy to use, user-friendly booking system.
Yeah, I love it. It's great. I can jump on at any time and
you can cancel online too.
Yes, I usually don't cancel.
No, because then you can't get another appointment. Appointments are very hard to come by.
Yeah.
So I should mention that we're very busy at Grandview. We try very hard to accommodate people because we have 7 treatment rooms. We're open till 8 o'clock at night. We have lots of therapists, but we're very busy and well established. And right now, this is the busiest time of year because people say, oh shoot, I have 3 massages left on my benefits. I'd really like to use those. So we find them coming in this time of year. So we're very busy right now.
Okay, good. Now, where can people find you online? What's your website, and give us a phone number as well.
Yes, so grandviewmassage.ca will take you to the website.
Okay.
And from there you can book an appointment or get the phone number or whatever you need. The phone number is 519-624-4001. And then in Paris, we kept the phone number similar, so that would be 442-4001.
Oh, good.
But grandviewmassage.ca would take you and get you anything you need.
Get booked. Excellent. Okay. Okay, perfect. Now, let me ask you, was there any question that I didn't ask you that I should have?
I think you asked all the good ones. Massage, yeah. No, that's, I mean, I could probably go on and on, but.
Yeah, if there's anything you want to touch on, by all means.
Yeah, well, you know, I'm kind of proud of some of the awards we've won at Grandview.
Oh, great. Okay, tell us about that.
Yeah, so the Cambridge Reader's Choice puts out an award every year. So we've won Best Clinic many years in a row. Best RMT, acupuncture this year. We're just in the voting session right now. So osteopathy, we've been nominated, so we'll see what happens there. We've won a couple Chamber of Commerce awards. Our receptionist, Ellen, won an award for Best Customer Service.
I saw that.
Yeah. 2 years ago, myself, I also won an award for customer service. We have a Consumer's Choice Award for Best Clinic in 2019. And I'm proud because we really try to support the community. We sponsor Cambridge Minor Hockey, Cambridge Softball, Argus House, soccer. I can't even think of all of the sports, children's organizations, Big Brothers, Big Sisters, United Way, you name it, we sponsor it. We never say no to a charity. I really believe in community, and that brings people in too. I think that's part of our success and why we're so busy. We love being involved in the community. We often do food drives, you know, so really involved, and we never say no. So if somebody has a charity and they're looking for a donation, that is something we would do. Awesome.
Very good. Michelle, thanks a lot for agreeing to this. I know it's been a long time coming. We've spoken about it quite a while, but you seem to be nervous about coming on. You did great.
Oh boy, yeah, I was nervous. I wasn't even sure if I'd be able to turn the laptop on. Like I said to you in the beginning, I'm much better with people than I am computers.
I'm just glad you didn't reach out to Karen for technical advice.
I'm going to tell her you said that.
Well, it's on tape now. She'll see it.
Oh yeah, she's going to know.
Michelle, thanks a lot. I appreciate it.
Well, thanks for having me, Walter.
Okay, you bet.